Hi, Jamie Davis from The Nursing Show here at ANIA 2015 in Philadelphia. I'm really excited to be here and talk with Lisa Ann Bove. And we're going to be talking a little bit about project management in nursing, which is, probably if you know what it is, that's probably okay, but maybe people don't know what that is. But before we jump into that topic, I want to ask you, tell us a little bit about your nursing background, what you do and how you became a nurse.
So I always wanted to be a nurse. As a little kid, I used to take care of people. So it was one of those things I always wanted to do. I went to school, I got a 4-year degree, got out, and almost immediately got into critical care nursing, which I loved, here in the Philadelphia area. And I worked as a nurse, went back to school, got my master's degree, became a clinical nurse specialist in critical care, worked for a few years that way, and gravitated into the computer side, which was also something I always wanted to do. And so I started helping as a super user in my hospital when we implemented order entry, and then moved into a vendor and eventually into consulting. So I've been doing nursing informatics for as long as I was a staff nurse. So half of my career has been nursing informatics.
That's exciting and really just interesting to see how you progressed from one thing to another and got into something different each time. So we're going to talk about project management, but before we do that, we need to talk about what is project management.
Okay, so a lot of us really do project management to a point without even realizing it. So before I can say what project management is, I have to say what a project is. And so the formal definition of a project is a temporary endeavor, something that has a start and an end date. And it's to meet some objective or goal. A project is something to solve a problem. Project management is the way to manage that project, to keep it on time, on budget, and meet the expectations of the people you're doing the project for. Okay.
So what can nurses do to bring project management into their practice? Because how does a project relate to patient care?
So I didn't know project management when I was taking care of patients, but once I learned it, I wish I had. Every day as nurses, we take care of our project. We just call them patients. So we start our day by learning what we need to know. We have a goal for the patient in our care plans or our outcomes. And by the end of the shift, we hope that they are better or at least still progressing. So that's kind of our project. The temporary endeavor is our shift. Sometimes it's multiple shifts because we come back and take care of the same patient over and over again. And we don't realize we're managing that project, so to speak, by integrating our conversation with other people, by checking to make sure that the other departments are doing the things that are on the schedule for the patient, communicating with the physicians, communicating with the families, and hopefully getting that patient discharged to home.
So Lisa, how does project management relate to the nursing process?
So both project management and the nursing process have 5 phases. The nursing process starts with an assessment. You diagnose, you then plan what you're going to do for that patient, implement it, and evaluate it. The phases in project management are very similar. You initiate, you plan, you implement, you control or execute, and then you close. So the closing phase is a lot like evaluation phase in nursing.
Well, excellent. Well, Lisa, we could talk a lot more about a lot of other nursing informatics topics, I'm sure, but it's great to have you here on The Nursing Show. Thank you so much for coming by.
And thank you for having me.
And I want to thank all of you for checking out this segment here of The Nursing Show from ANIA 2015 in Philadelphia. And you can find more segments like this one over at the channel you're watching now or at nursingshow.com.